If a punishment is intense and immediate, A, the behavior is less likely to access reinforcement, more likely to be suppressed, and less likely to only temporarily affect behavior. B, the behavior is less likely to access reinforcement and more likely to be suppressed. C, the contingency is more likely to be ethical and appropriate to use before using reinforcement procedures. Or D, the contingency is more likely to be ethical. We know that punishment factors include that intensity or magnitude of punishment matters. The more intense the punishment, the more response suppression we're going to get. And the more intense the punishment, we know that it's going to be less likely to access reinforcement. So when looking at our answers, we have A, which is the behavior is less likely to access reinforcement, more likely to be suppressed. Neither, I would say that those are both true. But the thing that makes this incorrect is less likely to temporarily affect behavior. Punishment actually is still temporary. So A is incorrect. B is the correct answer, which is the behavior is less likely to access reinforcement and more likely to be suppressed. This is true. If it's an intense punishment and an immediate punishment, we know that it's less likely to access reinforcement because it's immediate. And we know that it's more likely to be suppressed because it's an intense and immediate punishment. But it is still just as likely to be a temporary solution. Punishment is a temporary solution, which is why recovery from punishment exists. So B is the correct answer here. And then for C, the contingency is more likely to be ethical and appropriate to use before using reinforcement procedures. So it's possible, like there is a certain level of intensity or magnitude of punishment that is required for it to be ethical, because it's not ethical for us to implement procedures that are unlikely to be effective. And so without the appropriate intensity and magnitude, it isn't as likely to be effective. And so it's possible that the contingency could be more ethical and appropriate. But due to our ethics codes, we're never going to choose a punishment procedure over a reinforcement procedure unless there's specific reason to do so. Like we've already tried that before, it's already been shown to be ineffective. And so making it immediate or intense is not going to make it more appropriate to use before reinforcement procedures. We should still be using less aversive procedures first. The other note for this is that, again, this is the problem with using punishment. The vast majority of studies that we have about punishment are, again, over 40 years old, which means it's ethically not appropriate to use anyway because we have rare current research about punishment, especially with the populations that we are most likely to work with. And then more problematic is that we have to take from peer-reviewed evidence the intensity of punishment that we should use, the magnitude of punishment that we should use, except for there's no current data giving that to us. So again, we have to be very, very careful in our use of punishment procedures because we don't have peer-reviewed data that is current and that is not 40 years old. That is a breadth of data that shows us the exact right intensity to use, which means that we run the risk of acting unethically by utilizing punishment procedures at all. Because if we don't do it intensely enough, it may not be effective. And if we do it too intensely, we're doing an aversive procedure that's unnecessary. And the data that the peer reviewed literature that would support our decision making in that doesn't exist, or at least doesn't exist recently. So there are some other punishment factors which we'll cover over the next few questions, but it is really important to consider that when we have to use punishment, we do need to be really cautious in our implementation of punishment. We should have been well versed and supervised in punishment procedures, or we should not be utilizing them. And we should be reviewing data more often than we do with other interventions.